All right. Well, for the sake of timeliness and expediency, welcome to our chat about testosterone this evening or this afternoon, depending on what part of the country you're in. Everybody should have access to the chat bar in their Zoom. So we'd love to hear what part of the country people are in. If you want to chime in what state or city you're coming from, that'd be cool. So we have a sense of the breadth and depth of all this. Hey, Canada, see you out there. Toronto, feeling you in Phoenix for sure. Got some East Coast representation. Oh, Vegas, baby. All right, now we're getting real. Anyway, look, good to have everybody join us this evening. My name is Dr. Rob Mordkin. I am going to be our moderator for the night. Or for the event, which we're scheduled for an hour. I don't think it's going to take us nearly that amount of time to get through the content. And really our goal is to give the high level content and then an opportunity for people to chime in via the chat, and we'll try to get responses to the questions as best we can. I'm the Chief Medical Officer here at Let's Get Checked. And happy and excited to be joined by my really good friend and very, very qualified colleague, Dr. Greg Bernstein. Greg, let me pass it to you really quick. You can give a quick intro and oversight about your background.
Yeah, thanks, Rob. And thanks to everybody for joining on to the webinar. I see Nashville there. I'm a Vanderbilt grad, so shout out to you guys down there in Tennessee. So I'm a urologist. I work in Northern Virginia at VHC Health, which is an independent hospital. I did my training in the military for urology training, and then I have a particular interest in men's health, as well as testosterone replacement, low testosterone, enlarged prostate BPH, and infertility. And so I'm looking forward to talking today to the folks out there about testosterone and some men's health issues.
Great. Well, thank you, Greg. I'll thank you now. Thank you at the end for being willing to join us. We're fortunate to have somebody with your experience jump on with us tonight. So a little bit about who we are as a company and what Let's Get Checked aims to accomplish. The stated goal of the company in terms of a mission statement is to help people live better, healthier lives. We do that by providing direct consumer access to health diagnostics, and specifically we're talking about lab testing. The diagnostic platform that we utilize enables an individual to self-collect a specimen from the convenience, the anonymity, the safety of their own home. All of our tests are run at our own high complexity CAP and CLIA certified laboratory with lab results that are validated and accurate. We support all of that through a telemedicine offering as well with our group of physicians, nurse practitioners and nurses. And we actually have our own pharmacy as well to prescribe various medications when appropriate. Patients interact with Let's Get Checked and with their labs and their results and all of these other components via web access, as well as Android and iOS app also are available. And we have a variety of different tests that we do. Tonight, we're going to focus on testosterone, which is one of the many biomarkers that we have the capability to test at Let's Get Checked. We're going to kind of talk high level about, really what is testosterone, talk a bit about the connection to bodybuilding and exercise. Greg, who's, as he said, he has an interest in expertise in men's health in particular, is going to get into some of the weeds about how you might consider maximizing workouts and how that relates to your testosterone. How to be on the lookout for low testosterone, what maybe some of the signs, symptoms might be, and then how you might go into the diagnostics around it and potentially into treatment as well. And then, some things that you can potentially take home to try to improve or at least maximize your own health as it relates to testosterone and hormones. So with that, let's kind of jump in. So starting off, what is testosterone? Testosterone is generally referred to as the male hormone. It is a hormone in our bodies that really plays some really crucial key roles. It is, sort of the driver of going, from puberty and through into post-puberty, which includes the onset of fertility, improves significantly and is directly involved in supporting and promoting muscle mass and muscle growth. Bringing about those sort of pubertal changes that we think about in terms of secondary sex characteristics like hair growth and deepening of the voice, and also directly involved in keeping our bones strong and healthy as well. So, testosterone works in a lot of different parts of our bodies, but overall is really crucial in the male body, certainly to proper health. I should also mention, it is produced primarily by the testicles. That question comes up from time to time. So that's where that hormone is actually produced in our bodies. So our testicles actually have two major functions. One is sperm production, and then the other is the hormonal component, which is the production of testosterone. I mentioned a minute ago that puberty and the onset of puberty is actually driven by an uptick in testosterone production. So, if you look at a young male child, and then you look at a child in puberty and then a young adult male, there's about a 30-fold increase in the level of testosterone in the bloodstream as somebody courses through that puberty period. But it doesn't just continue to rise forever. The testosterone levels sort of level out and then actually begin to fall a bit as we age. So once somebody a man is through their third decade of life or so, their testosterone levels will actually slowly, but naturally begin to decline. And, particularly as you get on in your decades of life, and if you look at people into their 50th, their fifth, sixth, and seventh decades and beyond, the testosterone levels will fall even further.
Rob, I'm just going to chime in and say that's actually okay. It's actually normal. It's a normal part of the aging process. It doesn't mean there's anything wrong with you as those testosterone levels start to decline. So it's just something to be aware of.
Yeah, that's a great point. I think, people, particularly depending on the age when they might begin to focus in on their testosterone, might think that, their numbers are abnormal. And as you point out, it may just be what's normal for their particular stage in life.
Right.
So yeah, that's a great point, Greg. Okay, let's go to the next one. So there are some other hormones when we start talking about testosterone. There are some other hormones that at least the terminology is important to have heard. I think one of the more important ones in sort of the whole management and evaluation of testosterone is the sex hormone binding globulin. This is a protein that actually can bind to testosterone so that the testosterone molecule and the SHBG molecule can bind together. This affects how much free-floating testosterone there is in the bloodstream. And depending on somebody's levels of SHBG, that can ultimately lead to issues with testosterone, because it's ultimately the free testosterone that is the impactful component in terms of, cellular function and muscle growth and all of those kinds of things. So, it can be important, and I think Greg probably can get into the weeds a little bit more on this down the road, but in evaluating testosterone, sometimes it's important to also know, not just the testosterone, but what is the SHBG. And that's what the second term is talking about a little bit too, this free androgen index, the FAI, which is really looking at the total amount of testosterone as compared to the level of SHBG. So the total testosterone refers to how much free-floating testosterone plus how much is bound to SHBG. And so knowing that ratio can be impactful in sort of really understanding what is truly your level of functional testosterone or available testosterone.
Can I just jump in there, Rob?
Absolutely.
I think it's important for people to know, and I have this conversation with my patients, that about 98% of your testosterone gets bound up by protein, not only the sex hormone binding globulin, which you really can't control that level in your body. It is what it is. It changes throughout your life. There's another protein called albumin, which also binds up some of your testosterone. So in reality, only about 2% of the testosterone that we produce is free and circulating and available to do all the normal bodily functions that Rob referred to on the previous slide. So when I see patients, I think it's really important, actually, because there are some people that live their entire lives with levels that would be considered on the lower end of normal. But when you take into account their protein levels and you look at their free testosterone, they actually have normal free testosterone levels, and that's okay. That happens to just be where they are. So sometimes knowing your total number is important, but it's probably better to know your free testosterone level.
So Greg, just, I guess, expressed another way, just to clarify, somebody could actually be at the lower end of a total testosterone, but their free testosterone component, which is the impactful component, if you will, may be actually quite normal. Is that
exactly? That's exactly right. Yep.
Okay, great. Well, thank you for that and that clarification. Some other, hormones that can impact testosterone and certainly play a part of what we deem in medicine the hormonal axis, which is the interplay between all these hormones. Another one is prolactin. This is something that comes from the pituitary gland in the central nervous system, and can impact certainly, how much testosterone our testes are secreting, and also can directly impact as well the quality and amount of sperm production. Other hormones to just mention, estradiol. This is one that also gets involved in sperm production to some extent, certainly if there's elevated numbers, and can also affect sex drive and even erectile function, and is a number that, much like testosterone, does change over time. And then finally, cortisol is one that might be familiar to a lot of people on the webinar, which is considered a stress hormone, but it is one of these hormones that our bodies release in response to stress, and can also, impact other components of our body that could ultimately then feed back to testosterone production as well. But I think just familiarize yourself with those terms is really all we're trying to get out of that. Again, we're here to really focus on testosterone itself. So this is one of the interactive portions of the evening. Feel free to hop in on the chat on this. So we're going to go to the first question here. And the question is, women, should they have some element of testosterone in their body? True or false? So let's see how the group does here. We've got
actually just before you read that question, somebody put in the chat, there was questioning, is this test a testosterone test for women as well? Because isn't it normal for women to have testosterone? So
good.
Looks like our panelists know what's going on here.
Yeah. So everybody, I haven't seen a false go by yet. Right. So the answer is, the big unveil is yes, it's true. Maybe we'll go next level and say, well, okay, do you know where that testosterone actually comes from in the women? So let's see if anybody out. It's not on the slide here, but I'm just going to ask the question. Does anybody have a sense of where the testosterone in women actually comes from? Ovaries. All right, good. Yep, there is a small amount of production from the ovaries. Correct. And there's one other place that I think is pituitary. No, close. Not pituitary gland, adrenal. Yes, there we go. The adrenal gland. So there's a small amount of testosterone production that comes from our adrenal glands as well. And in men, it contributes to about 5% actually of the total testosterone production in a man's body. So well done. Let's go on to the second question. True or false that only older men will experience or can experience low testosterone levels? Yeah, false, false, false. Correct. Let's go to that. Let's the big reveal. Everybody's right. Yeah, it is definitely false. And Greg will talk about this a little bit later. Well, he mentioned that, it may be normal for an older man, particularly depending on their age, to have lower levels. They're not the only ones that may be experiencing low testosterone. Next question. Significant drops in testosterone are normal as you get older. I think we've beaten this one into the ground. Yes, everybody's, hopefully if they've been listening, the answer to that is Okay, so here's the key: significant drops. So we mentioned that there is a drop in testosterone that's a normal part of aging, about 1% or so per year. But it's a bit of a trick question because of that term significant. And it's a little bit about how you define significant. But in other words, as you get older, yes, your numbers are likely and are normally going to go down. But there should not be a precipitous drop. And certainly, there's no reason to expect that your numbers should be very, very low. And that's why it's important to sort of know your numbers, particularly if you're having symptoms and questions and concerns that make you think you may have some testosterone issues. So significant drops is the key, the significant term there. All right, and let's go to the final question. Does low testosterone cause infertility? True or false? See a true. I see a negative. All right, the first two responses are split directly down the middle, not on its own. All right, now we're going next level. That's great. All right, so the big reveal here is that correct. It does not, in and of itself, impact fertility. Greg, you're our resident fertility expert on this, so maybe I'll let you comment on that now.
Yeah, I think the way that you have to be, the way the question is worded, low testosterone causes infertility. I would say it's a factor. It can be affiliated with fertility issues, but it's not the sole cause. There are a lot of factors that go into fertility, both on the male and the female side. So you have to just be careful with the way the question is worded there and think about it as a bigger picture.
So, true statement then, if you have low testosterone, and I know that's a pretty broad term, but if you have low testosterone, it does not in and of itself mean that you're going to be infertile. However, if you are struggling with fertility and as part of the workup, you're found to have low testosterone, the fertility might be improved by improving the testosterone. Is that?
I think that's a fair statement for sure.
Okay. Got it. All right, great. Well, good. I think everybody did really well there.
So there's a question in the chat about when we're talking about testosterone, are we talking about free testosterone? Generally, we're talking about total testosterone. That's really the common test that people get checked out in the community. It's really only probably when you get down into a urologist's office or a specialist office where you're going to get into the weeds, or even an endocrinologist's office into the free testosterone versus total testosterone. But generally, we're talking about total testosterone. So that's a great question.
All right, so let's get into what happens in terms of bodybuilding and why getting our bodies through puberty and all that in the men's world, it's important, and where testosterone works. So testosterone influences muscle development and fat distribution inversely, so that muscle development is promoted by testosterone through what's called an anabolic pathway. But essentially what that term means is that it promotes protein synthesis, and protein synthesis is crucial for muscle development, muscle growth, muscle maintenance. On the other side of that coin is it will diminish or decrease certain elements of fat distribution. And so, this is one of the common reasons that people might get concerned about, hey, what is my testosterone level, if they're noticing that they're either losing muscle mass or they're having a hard time, building muscle mass, and perhaps they're starting to have a bit more fat. That might raise questions about, is testosterone levels waning, or is it playing a role? The other area that I think it's really important to just mention, and often gets sort of a second fiddle to the muscle conversation, because that's the one a lot of people tend to focus on, but is the importance of testosterone for bone density. And so people may be familiar with the term osteoporosis, which is essentially a thinning of the bone, which is common as people age, certainly more in women than in men, but men can also have it develop. And one of the ways to best combat that and to try to preserve and maintain healthy, strong bone is by making sure that your testosterone levels are in healthy and in normal ranges. So, bone density is very important too. I saw there was a question about bone density that just flipped through the chat. I don't know if you caught that, Greg, or not. Maybe we can come back to it. I didn't see it. Oh, here we go. Question about bone density, idiopathic genetic predisposition to weak bones, osteoporosis, given HCG to increase T levels, skyrocketed E2. I got to be honest with you, this is beyond the scope of what I think. So there's a lot of questions in here about some very specific levels. So I apologize, AG. We're going to probably, it gets.
I think I can probably answer that real quick. I think, as you know, testosterone and estrogen, these are all steroids, and they're all, basically the steroid is the original sort of form, and all these hormones develop from that, and they're just different bonds that create the different hormones. So of course, as you increase your testosterone levels or increase hormone levels, you're going to get increase in your other hormones as well, particularly estradiol. So I think, one issue in order to keep your estrogen levels down, without an aromatase inhibitor, you might want to just take a look at how much testosterone you're actually getting or how much HCG you're using. It could be that you're using too much, and you may need to dial that down a little bit, and you may see that you're getting less conversion to estrogen. We also know that testosterone levels convert to estrogen in fatty tissue or adipose tissue, and so certainly weight loss is another way to prevent that conversion of testosterone to estrogen.
And I saw there was a question around SHBG being high. We're going to talk about that in a little bit, so we'll table that one for the moment. But I promise we'll come back to that. So, again, I mentioned before that testosterone affects muscle growth through this anabolic pathway and improving strong bones and muscle. And as we mentioned before, we know that as we age, our testosterone levels go down, but there are definitely going to be a significant number of men that really the numbers are going to be even lower than would be ideal or be truly healthy. And in those people that get identified that way with low numbers, then improving testosterone levels can help sort of reverse the cycle, lower the body fat, increase the muscle size, increase bone strength. So can bodybuilding cause low testosterone levels? Well, interestingly, there actually can be a bit of a bump in testosterone with weight-bearing exercises, transiently, sort of at the time or soon after the exercise. But certainly excessive exercise, to supreme fatigue and things like that, could begin to lower testosterone levels, in and of itself, although, and Greg, I'll let you step in on this, but that's not likely the reason somebody's walking in with really low testosterone levels.
No, I mean, listen, I'm a big believer in moderation. I believe in working out. I believe in exercise. I believe in a good diet and exercise, but anything, no matter what you do in life to extreme, is not going to be healthy for you, and is going to affect your body in a lot of different ways. It's going to put a lot of stress on your body in other different ways. And as you put stress in your body, you're going to interrupt and disrupt a lot of your hormones and other factors. So you just have to be, there are folks out there, obviously, that are elite level athletes that do this professionally. But for the average, weekend warrior that works out on a regular basis, if they start working out too much and they're not doing that as a professional, they're probably going to, impact and hurt themselves and see some other issues that are going on.
Thank you. There was a question about the lab report from Let's Get Checked. So androgen-free index is reported. It doesn't get into the weeds around sex hormone binding globulin and things like that. But you're asking, the question in the chat was asking, is it meant to bring, the report meant to bring to your practitioner? The answer is yes. It is something that, you can download in a PDF and bring to your primary care physician or your endocrinologist if you're working with one of them. This is actionable data and meant to be actionable data. And I would say the true is really of all of the panels that we offer. These are results that you should be able to walk into your doctor's office and show them and be able to use as actionable information. So I hope that helps. All right, let's go on to our next slide. So Greg, I'll pass this off to you, which kind of gets a little bit more detailed about how to, sort of promote and maximize.
Great, thanks. Thanks. We're gonna talk a little bit about how to get the most out of your workouts. Let's go to the next slide. So how can you get the most out of your visit to the gym? So I think, as I was just sort of alluding to it a little while ago, I think you want to work out regularly. So if you're working out once a week for 3 or 4 hours, you're probably not going to see as much benefit unless if you're working out, every day or every other day. I mean, you need to give your body time to recover. You need your muscles to recover, your lungs to recover. So, you have to do everything in moderation, but working out regularly is going to be better than working out once a week or once a month. That's for sure. Obviously, you want to keep yourself well hydrated. Drinking water throughout your workouts, you're going to expend a lot of energy. You're going to sweat a lot, and you need to make sure that you're keeping your organs healthy. And water and hydration is super important in that regard. Protein-rich foods are great before you sleep. It's going to help your body recover. It's going to help your body build protein and muscle back, and that's what happens at night. And you should never really work out on an empty stomach. The best thing you can do is get a little carbohydrate. I like to, put a little peanut butter before I go work out, get a little sugar in the body. It really gets your body revved up, it gets your metabolism going, and it's going to give you a better, more effective workout. Even if you're trying to lose weight. I mean, I know a lot of people go on carbohydrate, free diets and high protein diets, but again, you have to have some moderation in there. You can't eliminate everything and go all in on something else. And you want to make sure you're getting enough sleep. And then as far as your testosterone level, again, this is a piece of the pie. You'll notice it's not the first thing on the list here. It's not the only thing. There are about 6 or 7 things on this list here. And so testosterone, I look at as a piece of the pie here. Do I think everybody needs to know their testosterone level before they go work out in the gym? No. But if you're doing a lot of these things, you're doing in moderation, and you're not seeing quite the results that you're looking for or hoping for, it could be testosterone related, but it may not be. And that's where knowing your level and getting a Let's Get Checked is a simple, easy way to get that number. Next slide. So how can you build muscle with low testosterone levels? Well, again, you have to be careful when I say low testosterone. There's a big range of testosterone. The levels range anywhere in some labs from 250 to about 1100 or 850. And you can vary, from day to day, week to week. The time of day that you get your levels checked is going to vary as well. So I sort of think, again, going back, you want to make sure you maintain a healthy weight. So weight gain, as I alluded to, the testosterone levels can convert to estrogen levels in the fatty tissue. So you want to maintain your weight, which is going to be good for your bone and bone preservation. It's going to be good for your testosterone levels. You want to exercise regularly, as I suggested in the previous slide. The protein-rich foods, again, are going to help with your muscle recovery, sleep, and moderate your alcohol intake. That's a lot of carbohydrates there, a lot of calories. So that's going to certainly affect your workouts. And then avoid smoking, and that's sort of a no-brainer. Just for a whole host of health reasons, you should avoid smoking. What about your diet to help with the gym performance? So, everyone's different, as I've mentioned already. There's really not a one-size-fits-all diet when it comes to nutrition. So, have to be careful. Again, you don't want to put yourself in a deficit of something that you might need. To find out if your diet's giving you what you need, I would, regularly check your micronutrient levels. This can be done. There's, some testing that you can do here with Let's Get Checked with your primary care doctor. Oatmeal is a great breakfast for those who are active to give you a little energy pre-workout. That's that carbohydrate that I was talking about. It's going to get those sugars. The cells like the sugars. It's going to give you a little pep. It's going to pump you up. It's going to get your blood glucose levels up as well, and get you focused on your workout. Green vegetables are rich in iron, which also help with muscle and gym performance. Bananas are going to give you some electrolytes in terms of muscle recovery and reducing cramps. And then almonds are going to give you a quick little boost of energy as well because of their high protein level. It's no surprise that really protein is key. Food sources such as beans, peas and lentils, white fish, and Greek yogurt are great for protein. So I think as you look at the slide, and what I think about is you really have to have a well-balanced diet. I know there are a lot of paleo and South Beach and caveman type diets that people swear by, and they might work for somebody. But I think if you look at the natural history of diets, it generally works for a while, but a lot of times people will go back once they stop doing it to what they were before. So if you just kind of have moderate diet, a balanced diet to begin with, and you moderate your total calories that are going in, you're probably going to do better to kind of control your weight and be healthier. So what about supplements? So if you have a vitamin or a mineral deficiency that's identified by your doctor, then you might want to consider supplements. You know, again, your body's pretty smart. So if you're taking vitamins, every day, a multivitamin, that's great. Your body's going to retain what it needs or what you're lacking in, and it's going to get rid of and excrete whatever you don't need or whatever's extra. But certainly if you have a deficiency, you want to make sure you're replacing that. And again, most people are going to get a pretty balanced vitamin and minerals if they have a pretty well-balanced meal. You know, for folks that are vegans or that don't eat meat, they might become a little deficient in vitamin B12. So it is important to know some of your vitamin and mineral levels so you can make sure you're not lacking in those. Testing is a great way to check that out, you know, just as long as those are normal and replaced, then it's going to help your workouts as well. Next slide. How to spot low testosterone. So that's a great question. Let's go to the slide here. So, you know, low testosterone, there's not a simple, I mean, you can check a level, but getting a level doesn't always mean that that's clinically relevant. If you look at a lot of the things on this slide here, lowered sex drive, a decreased semen volume, difficulty achieving erection, increased body fat, loss of muscle mass, fatigue, hair loss. These can be signs and symptoms of a lot of other medical conditions. They can be normal signs of aging. They can be signs of depression. They can be signs of side effects from other medications. So there's a host of, you know, symptoms here that can be associated with low testosterone. If you're experiencing them, obviously it's one thing to get checked, but I don't know that it's going to be the holy grail that's going to fix all of these things, but it is important to know. So these are some things that can happen, but could be signs of other things as well. So, you know, I see plenty of patients in my practice that come in with some of these symptoms. A lot of times we'll check their testosterone levels and they sometimes are normal, and sometimes they're not normal or they're low. And we just sort of approach each case individually. It's not a one size fits all. Next slide. So testosterone deficiency, what can cause low testosterone? We talked about aging, right? So your testosterone levels are going to go down by about 1% per year after the age of 30. So aging by itself is going to cause lower testosterone, but stress is going to cause that as well. Remember, we talked about testosterone as a steroid hormone. We talked about cortisol a little while ago, and stress can affect your hormone productions. Obesity, we talked about with the conversion of testosterone to the estrogen, so that can lower your total testosterone levels. If you have injury or infection of your testicles, that's going to impact your testosterone levels as well. Chemotherapy or radiation treatment, which can have secondary effects on the testicles and testosterone production. Genetic abnormalities such as Klinefelter's, which is where you have an extra Y chromosome. Hemochromatosis, which is an iron storage disorder, and then pituitary glands, which is a little gland that sits in the base of your brain, and then diabetes. So again, there are a lot of things that can cause impacts on your testosterone, and I think it's important to know that, you know, your level today may not be the same level tomorrow. It may be different 2 weeks from now. And so if you do get it checked or you're worried about your levels, I never make a decision on a single testosterone level. I always check at least twice, and if there's vastly different, I'll even get a third level, and I always make sure to check them in the morning. Testosterone typically follows a circadian rhythm, which means it fluctuates throughout the course of the day in 24 hours. So for people that have normal sleep-wake cycles, so they work during the day and sleep at night, your testosterone levels are typically going to peak in the morning, and they're going to be lower in the afternoon. And so it's ideal to check your levels when they're highest in the morning. That's going to give us an accurate representation of what your true testosterone levels are. Next slide. So male hypogonadism is a diagnosis where a man doesn't produce enough testosterone or sperm or both. Okay, so that means that your testicles are not working correctly or not doing what they're supposed to do, since that's where you get 95% of your testosterone. You can either be born this way, or you can develop it later in life from an injury, an infection, or treatments. Primary hypogonadism is basically the result of testicles that never developed properly, and then secondary is somebody who develops problems with the pituitary gland, or their testicles develop an injury or problem down the road, and now they were producing testosterone normally, and now they're not. Other over time, male hypogonadism can cause a number of complications, as we've alluded to already, such as erectile dysfunction, infertility, decreased hair growth, loss of bone density. So I just saw, I think Rick W. just made a comment in there about the fact that he's a recovering addict. Certainly, narcotic use can significantly impact the pituitary gland and that whole hormonal axis that Dr. Mordkin referred to, and that can lead to secondarily having low testosterone levels, not because it's impacting the testicles per se, but more the fact that it's impacting the stimulator, the pituitary gland in the brain, which releases the hormones to stimulate the testicles do what they're supposed to do. So I'm sorry to hear that, Rick, but not uncommon. Next slide. Can low testosterone be treated? Absolutely. So, many men with low testosterone will use testosterone replacement therapy to restore low levels, but it's not the only option. In fact, for many people, it may not be the best option. There are a lot of lifestyle changes that you can improve testosterone levels, such as a healthy weight, exercising regularly, getting enough sleep, moderating your alcohol intake, weight loss, as I mentioned, protein diet, healthy diet. So you can probably improve your testosterone levels. For every 10 pounds you lose, your testosterone levels are going to probably go up 10 to 20 points. So, there's a lot that you can do short of taking a medication. One of the implications with starting testosterone therapy, if you work on the assumption that you're not producing enough, is that over time, if you use that, it's basically you're talking about lifelong therapy. Because once you start using testosterone or replacement therapy, your body's natural production, whatever's left, will shut down and stop producing, and therefore, if you stop using the therapy or the medications, then you won't have any reserve left to make your own testosterone. So it is a lifelong decision if you decide to go on testosterone, not for just a short course trial for 3 or 4 months, but if you've been on it for 2, 3, 4 years, you're looking at probably something that's not recoverable, or definitively not recoverable if you stop using it. Next slide, please. So testosterone therapy works by raising testosterone levels through a number of different forms. Unfortunately, we don't have a great oral pill solution or medication that we can use. So the way we replace testosterone is either topically with gels or patches or solutions that you can rub on the skin, via injections, which can be either long-acting or short-acting injections. There are pellets, testosterone pellets, that you can place under the skin every couple of months. There is a reference now to J-Tenzo, which is an oral supplement, which is starting to pick up some traction here. The literature and data is a little bit mixed on it, and so I don't think it's FDA approved, but I don't know that it's really been prime time in replacing a lot of these other tried and true therapies so far. So maybe down the road, we'll see a little bit more switch, but historically it has not been a great option. There is a nasal pump, again, but is often uncomfortable for patients to inject in their nose. So really, testosterone replacement is and the key here is recommended for those that have extremely low testosterone levels. If you're experiencing just a shift in your levels as you get older, we generally don't recommend TRT for all of the reasons mentioned already. Next slide.
I don't know, Greg, sorry to jump in, but I don't know if you saw there was a question.
No.
Somebody posted up their total testosterone numbers and sex-buying globulin and androgen index, and commenting if they want to increase their T. I think this might be a good point to jump in and say, certainly we would not be putting a patient, or I would not be putting a patient with those kind of numbers on.
Yeah, but those numbers look great. They look very normal to me. So I don't know why you want to increase your testosterone levels. With the numbers that you have there, that looks like everything's working correctly and your body's working correctly. So there's really probably no role to raise your levels. The one thing I've sort of learned over the past 24 years of doing this is that normal is normal, and you can't make normal better. And so it's just something that's sort of food for thought on that topic.
Yeah, thank you.
Yeah. So back to the slide about abnormally high levels. So, for men, I'm always careful when we talk about replacement that we're not talking about getting you, when we put you on therapy, if it's indicated, getting you at supra therapeutic levels, so levels that are higher than the normal range. We're looking at getting you back into the normal range if you're below the normal range. So, if you take too much testosterone and your levels get too high, it can shut down your fertility. It can cause some mood swings. It can cause some excessive body hair or hair growth. It can cause aggressive behavior, some damage to the heart, as well as sleep disturbances and increased muscle mass. So that's why people do it, a lot of times to increase the muscle mass. That's why people do hormone therapy when they're at the gym. But that doesn't always have, it has negative effects as well. So something to be careful of if you're doing replacement, that you don't want to get too high, and you want to make sure you get monitored on a regular basis.
Yeah, it's a really good point, Greg. I think testosterone is not a scenario where if a little bit is good, more is better. There are some significant potential downsides to the other side of the mountain there. Yeah. So
let me jump back to one of the questions here. So I guess there's a question here about concerned about T levels, and the prolactin level came back high at 31. So that could be suggestive of a problem in the pituitary gland. And so usually we send you to an endocrinologist to get your pituitary gland evaluated to make sure there's nothing abnormal there that's causing increased prolactin levels. But certainly prolactin is one of the hormones from the pituitary, along with your luteinizing hormone and your follicle stimulating hormone and your thyroid stimulating hormone. And so any sort of abnormality in the pituitary can throw all of those hormones off. And those are your hormone stimulators that control your thyroid and control your testosterone production and your sperm production. So I would, the short answer is I would probably follow up with an endocrinologist to talk to them about your prolactin level and see if any further testing is warranted.
Yeah, and to just add on a little bit, the question right above that was around pituitary as well. And if your physician suspected pituitary abnormality, what would you do about it? Or could that be why you're having issues with low T? Well, like the first piece is, do you really have low T? So obviously that requires the testing. Yeah. But if in fact the pituitary is ultimately suspected, then it requires imaging. So brain scan, usually MRI is going to be the way to evaluate that further.
Yeah. Okay. Next slide.
And so before we kind of get even into that, a lot of great questions are coming in. What was the question here was, what's the best type of doctor to understand my testosterone? Physician, primary physician has a scant knowledge. So not all primary care doctors are going to be experts in testosterone, although some may. But I think if you really want to get into the sort of the detail and around your own testosterone, and certainly, at a broader level, your own hormonal axis, that's best handled by an endocrinologist, would be one of the specialties, or specifically in the case of testosterone, if not an endocrinologist, then a urologist, but a urologist who has focus, interest, and expertise in testosterone and in male sexual health. So, but I think in either of those avenues, you'd be getting a pretty detailed knowledge base, but certainly an endocrinologist, this is going to be right in their wheelhouse. So let's kind of go on to the next set of slides. So, questions about what can you do to stay on top of your hormones? Not to be too redundant, but, very quickly, Greg mentioned a lot of this. Look for those signs of imbalance. Eat as balanced a diet as one can. Try to get as much sleep as you can. Manage your stress. I mean, if all of this was easy, we'd all do it. People always say sleep more and stop being so stressed out, and it just stresses me out to think about all that. You can certainly take an active role in reducing your alcohol intake. So that is something that I think can be managed and handled, and try to get regular exercise. And then, of course, if you still are concerned and you have questions, you can go get tested and begin to drill down deeper into understanding your own levels. And so, at Let's Get Checked, we offer, a whole range of different hormone testing. You can access it through the online portal or through the app. And feel free to consider ordering a test and beginning to understand better what your own levels are. It's one of our taglines at Let's Get Checked is it's good to know. And so if you want to know your levels, you can go ahead and get tested.
Yeah, I think there was a question earlier, Rob, about somebody wrote in the chat that they're, thought that there should be more information, when they get the report from Let's Get Checked about their levels. And I would say, and I'll let you jump in and answer this, but I would say that, Let's Get Checked is really not really wanting to they're just going to give you the number. And if you have questions about the number and the result, that's where you can go and seek a professional, have an appointment, and say, hey, what does this number mean? That's not really Let's Get Checked rule per se. Is that a fair statement?
Oh, absolutely. I think that's absolutely spot on. That's absolutely spot on. There was a question about male by name. Is it not for women too? So Let's Get Checked. We also have a whole female panel of testing that can be done. And so I just encourage you to take a look at that. It looks at some of this, but also at some other components that are more impactful for women than for men. Specific foods that are linked to improving testosterone. Any comments there, Greg? I mean,
again, I don't think, there are a lot of, if you go down that Google wormhole, you find pretty much anything that's going to support what you're looking for. And I think you heard me say earlier that I believe in just a well-balanced diet. I don't believe, I'm not anti-nutraceuticals or supplements. I think they're great. And I think for a lot of folks that they do a lot of great things. And so if you find that there's something that you want to use in a supplement and you think it's helping you, it's probably not going to cause any harm. Whether it's going to specifically actually raise your testosterone levels, I think that the jury's still out on that. But I think really, going back to, keep it simple, healthy diet, well-balanced diet, good sleep, lots of water, regular exercise, don't smoke. Those are really the things that there's no secret sauce here. If we knew what the secret sauce is, we'd be selling it and everybody would be doing it. But there's been lots of people that have come way before us that have been very successful. And so we all want that holy grail that's going to keep us young and keep us virile. And we've yet to discover it yet. So just keep it all in perspective.
Yeah. There was a question about free androgen index compared to free T. I don't know if you saw that one, Greg.
Yeah. So I've not heard of the free androgen index, but I'm assuming that's the same thing as a free testosterone, and that's how you guys have worded
calculated.
it.
Yeah, it's a calculated ratio. That's right.
Calculated, yeah.
Yeah, off of the free testosterone level.
Correct.
Yep. Correct. I'm not familiar with. There's a question in the chat about and Fudagio. I'm just not familiar with those. I assume those are supplements.
I'm not either. Yeah.
And there was a question about the recording. I think at the end, or I might ask one of my team from Let's Get Checked to let me know how they can access the recording for anybody that came in a little bit late. Maybe they could type it in the chat here, Carly, if you can. Seems like some people are just getting in. So if Carly, there's a way for somebody to type into the chat the way to access the recording, that would be great. The other thing to keep in mind is as part of the in response, as part of this webinar today, I know the Let's Get Checked is offering a 30% off discount by July 8th for any of the male hormone men's health tests. So you can see the discount code here, MENSHLTH30, to get that discount there as well. And Caroline just posted in there that it'll be on the YouTube channel, on the Let's Get Checked YouTube channel tomorrow. And there'll also be a link as well to that.
So a couple more questions just came in about xenoestrogens, which I'm not familiar with. But as far as your second part of your question about the environmental factors, so I would say that men have had testosterone issues forever. I think that it's only become more of a topic with a lot of the direct-to-consumer marketing that the companies that make testosterone have published. And so it's become a lot more talked about. It's become a topic that men now are encouraged to get checked, know what their number is. we're always learning more and more new medical information every single day that we may not have known 15, 20 years ago. So I don't know that it's necessarily increased environmental factors per se. I think it's maybe just more knowledge and more, direct to consumer, hey, take care of your health, and putting the onus on somebody to know what's going on. So the question is about Clomid. I don't know enclomiphene, but clomiphene or Clomid is a medication that stimulates the hypothalamus gland to release more gonadotropin-releasing hormone, which then stimulates the pituitary gland to release more of its hormones. So it's a way to try to increase testosterone levels naturally from the testicles, as opposed to using exogenous or testosterone specifically. So we use these treatments for younger men that have true low testosterone levels, where we want to preserve their fertility. They're symptomatic, and we don't want to put them on a patch or a gel or a pellet because we don't want to interfere with their fertility.
Yeah, and I'm not familiar with clomiphene either. I think that's a pretty nuanced question that you're going to want to get with an endocrinologist specifically to get into the weeds about enclomiphene versus Clomid. So, all right. I think we want to open it up for more questions. We have a few I know that had come in earlier that we could probably go to. I imagine we've covered a lot of them, but please feel free to continue to put stuff in the chat if other people have questions. Otherwise, we can go to the next slide. So, this is a pretty softball, but I've been training every day, can't seem to build muscle. Could I have low testosterone? Yeah, maybe. It's certainly a possibility, and it's easy enough to find out, right? And just go and let's test and see where it is. Greg, what do you think about a family history of low testosterone? I mean, do you find?
I've never seen that before. I don't really think there's a familial relationship. I mean, there's so many other factors that affect testosterone, so I don't think there's a true genetic predisposition for low testosterone.
Yeah, I would agree there as well. There was a question about starting TRT, testosterone replacement therapy. Do you need to be assessed first? Absolutely.
Absolutely, yeah.
Nobody should be going on TRT without knowing what their starting point is. It's hard to know where you want to finish if you don't know where you're starting. So you need,
and also to know the pros and cons, right? So it's
Exactly.
It's not as simple as eating a carrot. You want to know what are the benefits, what are the risks. As with any medication, you don't want to just start it blindly.
Yeah. No, exactly right. And as we said earlier, this is not an example of if a little bit's good, more is necessarily better. So you absolutely need to know where you're starting.
The last question about getting your levels checked. If I'm an active gym goer, I would say if you're noticing, changes in your results in the gym, you think it may not be related due to aging or something's different going on, or you're putting on fat despite no other changes, maybe it's good, just to go get checked in general by your primary doctor. There could be a thyroid problem, it could be a testosterone problem, it could be other medical conditions could be going on. So anytime you notice a change in the gym, if you're not getting the results that you used to get, whether it's with your cardio or your weightlifting, you want to see a doctor just to make sure there's nothing else going on.
Yeah, all really good. There was a question, I know there was a bunch that just came in, which is great. One around, I only gain significant fat around my love handles. Could this be testosterone level related? I mean, certainly it doesn't hurt to know your testosterone levels to better assess that. But I would say often sort of the location of fat deposition in terms of body habitus is very much a genetically predetermined component more than necessarily a specific hormone related. So in other words, if you just find that you're depositing fat around, love handles, so to speak, there's no harm in knowing your testosterone levels, but I don't think you're likely to find a smoking gun right there. I think that's a little bit probably more just genetically related to sort of what your DNA is. There was questions about, if it's normal to have lower testosterone levels in later decades, are there risks related to being prescribed TRT? are we rocking nature's boat? And I think, Greg touched on this a little bit, but certainly I think most physicians, and certainly for the two physicians that are involved in this panel, we want to get somebody's levels into sort of a normal range. So we're not even going to engage in a conversation or significant, or at least a serious effort to put somebody on TRT unless they've really got very low levels to begin with. Now, with that said, if they've got really low levels and they're symptomatic, moving them up into a normal range, it may improve some of those symptoms, and that's fine. And I wouldn't describe that as rocking nature's boat. On the other hand, if somebody's really sort of in a normal, and even if they get older, if they're in the lower end of a normal range, which is kind of where we would expect them to filter out, I don't think there's a lot to be gained by putting that person on TRT.
Yeah.
I don't know, Greg, your thoughts there?
Yeah, I would agree with you. I was looking at this other question about how much would T vary from morning to evening, and if you checked in the afternoon, could it be considered low? And I'd say you could see a swing in a couple hundred points. And so you could be, normal in the morning and absolutely low in the afternoon. So if you're going to get it checked, I think the take home is just get your levels checked before about 10 in the morning, usually on a couple different times, just to make sure you have an accurate level, because it is going to fluctuate day to day anyways. Mm-hmm. There was another question about, since it's normal to have lower testosterone in later decades, are there risks related to TRT? Are we rocking the boat? And I think that's a great question and a great point. And I try to make that with my patients, is that, yes, there is some normalcy to low T. I see a lot of patients and a lot of men that come in their 50s and 60s, 70s, and they're worried what their testosterone levels are because they want it to be what it was in their 20s. And, I have to counter that with say, well, there are risks if your levels get too high, and we put you on it appropriately, of increasing, blood clots, increasing your blood count levels. So it's not completely risk-free. We don't have the long-term studies on long usage of testosterone like we do for estrogen with women, where we know there was a lot of issues and studies were done there. So we're still learning because testosterone replacement has become a lot hotter of a topic in the past 8 or 9 years. We're still learning more and more, and we'll see what shakes out down the road.
Yeah, good point. I want to just address maybe a couple other quick ones here. One was around finasteride. The participant mentioned that finasteride inhibits conversion of testosterone to DHT, which is dihydrotestosterone. This is an enzyme. There's an enzyme in the prostate which directly makes that conversion, and finasteride inhibits that conversion. The question is, would being on finasteride mean that you would have higher free testosterone levels? Not necessarily. It's really not going to directly impact your testosterone levels, or not significantly, and certainly therefore really isn't going to lead to more muscle hypertrophy. So, I wouldn't say that, if somebody who's looking for more muscle hypertrophy should be on finasteride, or if they're having issues there, it's because of their finasteride, not at all. There was also another point, definitely get your PSA level tested before TRT. Yeah. I mean, this kind of goes a little bit to, should I know my levels before I go on TRT, or should I be assessed first? And the answer is absolutely. And that assessment doesn't just sort of begin and end at what's my testosterone level, and therefore maybe I go on TRT, but there's some other things to consider as well. PSA, which is a blood test that Greg and I deal with on a regular basis in the world of urology, is a blood test that's used as a screening tool around prostate cancer. It has certain very significant limitations as such, but definitely if you're somebody that's contemplating going on TRT, or is going to go on TRT, you really do want to know where your PSA levels are when you start. Not that somebody who has low testosterone and then goes on testosterone is going to develop prostate cancer. I think it's important to understand that testosterone doesn't cause prostate cancer. But right. If you're somebody who's got prostate cancer, and you then put somebody who has if you have a low testosterone level and you got prostate cancer and you put them on testosterone, you're essentially dumping fire on their prostate cancer dumping fuel on their prostate cancer fire. So yeah, you would certainly want to know what your PSA level is before you start TRT.
There's another question here, Rob, about being symptomatic but in a normal range, low 400s, is that we're starting TRT. That's a difficult question to answer. So I think if you're in the 400s, I don't know what your free testosterone level is, but that would be, in my book, a normal level. And I don't know that putting you on testosterone is going to really likely relieve your symptoms. I think if you wanted to try testosterone for a couple of months, 2 months, 2.5 months, you're not going to run the risk of any long-term issues, and then sort of reassess your symptoms and see how you feel. Your levels are certainly going to go up. So if it's really what's causing your symptoms, and your symptoms get better and your numbers go up, then it's a decision that you have to have with your doctor about whether it's worth staying on it long term. The other question about the ideal testosterone level for a healthy, active 23-year-old, there is no ideal testosterone level. It's whatever's in the normal range. In fact, if you're 23 years old, to be honest with you, if you're healthy and you're working out and you're eating well, I would probably not even recommend checking your testosterone levels, to be honest with you. I know that's not really what we're doing here with Let's Get Checked, but for a healthy 23-year-old, you're probably doing just fine. And I would just focus on a lot of things we talked about in the talk earlier. You may have missed some of the slides. I think you joined late, but healthy diet, regular sleep, protein in the evening for dinner, carbohydrates before you work out, lots of hydration, and that's going to give you the best chance of seeing the results that you're looking for in the gym.
I want to be mindful of time because I think we're actually just a bit over time.
Yep.
There was one other quick question I'll just answer really quick, was that somebody mentioned they'd had testicular cancer at age 20. At 40, they then got tested, and their levels came back really at normal, 840. And anything that they should be looking out for? I don't think so. Certainly nothing that they need to look out for just based on the as it relates to their hormones and their prior history of testicular cancer. So yeah, they're good there. If you have other questions, you can see the website or the email address there, support@letsgetchecked.com. Appreciate all the great questions. Sorry we didn't get through all of them, although I think we got through many of them. And I hope everybody found tonight helpful. And Greg, I can't thank you enough for participating in your expertise and insights.
Thanks for the invite, Rob. Happy to help out anytime. And nice to talk to everybody here.
Great. Thank you.